Veterinary anesthesiologists are doctors. We're veterinarians who did a residency studying anesthesia. We are specialty trained to manage patients that are undergoing anesthesia and sedation. We also have a role in pain management. So my role here in MedVet Columbus is really to help supervise and oversee the very large, very busy anesthesia service. Well, what made me want to become a veterinarian? So I grew up on a farm. We had horses and pigs and dogs, and so I saw veterinarians come out to take care of our patients, our pets, I guess at that point, their patients, and really just kind of was inspired by their ability to practice medicine on animals. So if I wasn't a veterinarian, what would I be doing? So as a hobby, I scuba dive. So for a long time, I've had an interest in becoming a dive instructor. So that still may be on the plan when I slow down on veterinary medicine and or retire. Probably go through and finish my dive master and become a dive instructor, because again, it's very technical. There's physiology involved, and you know, with my teaching background, you know, seeing other people succeed as they learn those different skills and being able to apply those in a life-saving situation, I think would probably be where I would spend my time. I'm Canadian. I've only been living in the US now for 5 years, but prior to moving here, I applied to the Canadian Space Agency twice when they had astronaut searches. And the second time I applied, I made it to the third round of selection before ultimately not being selected. But yeah, going into space would be an ultimate thrill and dream. Yeah, gosh, that's a good question as an anesthesiologist, because we get to work on all species, birds, reptiles, fish, all kinds of things. But for me, rhinoceros are still, that's where it all started when I was in Texas at the wildlife park. I was the rhino intern and worked with about 12 different rhino there, including a newborn calf. And yeah, once you've worked with rhinos, it's hard to go back. They're just so cool, so big, so strong, so smart, so gentle for something that big. They're just unbelievably cool animals. I think what is, you know, probably the best part for me at Medved is, you know, we say we are leading specialty healthcare for pets, and I think that's very true. I think we have really strong leadership, both on the medical side as well as on the clinical services side. We have access to all kinds of equipment in terms of investing in the kind of tools we need to do our job. So we really can practice at a very high level.